Hey everyone, welcome back to my channel. It's Dr. Alessandro, and this is a special edition video, but it's not about a funny, uplifting, or really directly dental materials related topic, but it is about a topic that does impact our profession and any profession, anything out there, and that's the topic of suicide. And this comes on the heels of a colleague of mine who very recently committed suicide. And he's somebody that I knew and that I'd worked with. So anytime you have a situation like that, it's very saddening, maybe confusing to see when somebody commits suicide and you don't know them. You just see a name on a piece of paper or hear a story from a friend, colleague, coworker, whatnot. But you know, when it's somebody that you've personally interacted with on a number of different times over a number of years, it becomes a different matter. I'm not going to go into the specifics of what happened in this case, but what I'm going to tell folks who are in that kind of bind, who maybe are thinking about suicide and who feel that maybe there's no way out, just get help. Find a suicide hotline, find some sort of resource, talk to your friends, talk to your family, talk to somebody you trust, somebody who cares, cares about you, and there are people that care about you. Just get the help that you need. Get the help that you need. Get the help that you need. I can't emphasize that enough. Because as much as you may think that nobody cares, there are a lot of people who care. There are a lot of people who would be very happy to help, would be happy to get the right resources in contact with you, to help you get out of that dark place. As much as you might think there's no hope, there pretty much always is. So get the help that you need. Stay alive. A lot of people rely on you. A lot of people care about you. A lot of people want you to be around because they want to share great things with you. Great moments. Happiness. So something you might not be thinking of if you're thinking of doing this is how much devastation will be caused in the wake of a suicide. A lot of people will be tremendously saddened. A lot of people will feel despair. A lot of people will be confused. They won't know why. You won't be around to tell them. You won't be able to tell them what happened. You need to be able to talk, and that way they can help you, because they're not going to know. And that's going to add to everything else that makes it so difficult for those who have to then mourn after a suicide. So get the help that you need. Don't do this sort of thing, because it really does cause a lot of pain for a lot of people. Beyond that, I can just say that hopefully this has helped folks. If anybody who is having a lot of trouble is watching this video, hopefully this will help you. Please get the help that you need. Please. Because, like I said, you may not think it, but a lot of people really rely on you and really want to be there to help you. So, let them help. Get the help. And maybe it won't be immediate. Maybe you won't be back on your feet at 100%, within a day or two. Maybe it's going to take weeks. Maybe it's going to take months. Maybe it's going to take years. And it might. But you'll get there. And it'll make everybody so much happier. Because, again, they'll be able to share joy with you and you with them. And that really is the most important thing. It's not about what we do. It's not about the money we make, the jobs we have, things along those lines. It's really about being with one another and enjoying a life, sharing great things with each other. And just being good. So thanks for joining me. Hopefully this made a difference. And I hope you're all staying well and healthy out there. And like I said, if you're somebody who's having trouble, get help. And if you know somebody who's in trouble, please help them. Thanks again.